Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thanks for joining me again this week. I am here again with Jeff Thomas and Joe Leigner, who are managing partners at U.S. Benefit Consultants, otherwise known as USBC. You may remember, for the folks that listen weekly, and I appreciate you being consistent listeners, Joe and Jeff were here a few months back, I guess that was July, when we talked about the Affordable Care Act and all things related to Obamacare. I was in shell shock at that time 4 months ago, and now as we speed up to the fall, more folks in our country have been made much more aware about what Affordable Care Act is, how it's going to impact them as employees and as employers. So I've asked Joe and Jeff to come back today to give us an update on all of the things that they've learned since July and help me and you understand how this is going to impact us and what choices we should make that are best for us going forward. So Jeff, Joe, thank you so much for joining me again today. So happy to have you back.
Thanks for having us.
I'll tell you, your show hit me right in the face. I was shocked at the idea that this is going to cost me probably $5,000 out of pocket. Where am I going to budget that for next year as a consumer? And I really feared and worried for the folks that really didn't know what this Affordable Care Act meant for them. We're hearing it now, but what do you see? Let's first of all, let's talk about the Affordable Care Act and Obamacare. Let's just back up for those folks that are listening that haven't, maybe they've been in denial, they don't want to deal with it yet. Let's keep it simple and start from the beginning. What is this?
Sure. Well, it was a signature law of President Obama that he wanted to get passed that actually was written into law on March 23rd of 2010. And his intent was to try and make healthcare more affordable, according to the name, the Affordable Care Act, and then also to try and help uninsured people get insurance. As we sit here today, the latest figures are 5 million people have gotten cancellation notices that their current plans will no longer be able to stay in force, and 100,000 have signed up. So 5 million have lost coverage or will be losing their current plan, and only 100,000 have signed up. Now, the people who have gotten notices that their plans are going to be canceled will be able to go to a new plan, but the new plan will have to comply with all the new regulations and the 10 essential health benefits. That's what you're talking about, Jeannie, as far as the sticker shock. If you were somebody who was, let's say, a young individual, male or female, and you had an insurance product that maybe cost you $75, $100, $125 a month for an individual policy, once the new plans come out or have come out, they're seeing those prices double, triple, sometimes quadruple because of the new rating methodology, which is called adjusted community rating, and then also due to the new essential benefits that have to be covered, even if you don't want them. I'll mention this and then let you. For instance, let's say I'm a young male that wants to buy a individual policy for myself. Well, I don't need pregnancy, obviously. I'm a young male. And also, I don't need pediatric dental or vision included in my plan. My plan is mandated to cover those benefits. So I'm paying for pregnancy in my plan, even though I can't get pregnant. I'm paying for pediatric dental or vision, even though I'm an adult. It's just, that's what people are really starting to have sticker shock over.
Right. And it's really hitting the younger folks because now you mentioned it, but in your terminology, so I'm going to bring it back and keep it simple here. What happened before, what I learned from our last show, is we were lumped in more appropriate age groupings. But now it is from, 18 to 65? Or?
Well, you have 0 to 20, 21 to 63, and then 64 and above. But really, once you're 65, you're going on Medicare. That's even changed some since the last time we were out, the way they did the ratings and stuff like that. But where most people are going to fall between 21 to 63, there can only be a 3 times rating difference. So in other words, just to keep this simple, let's say a 21-year-old can get a $200 rate. The 63-year-old cannot pay more than $600. The only exception to that would be if somebody's a smoker, you can actually have up to a 50% surcharge if you're a smoker. Some insurance companies are enforcing that, some are not.
Okay.
So that's sort of
But
case by
still,
case.
because it's more broad, you're going to be incurring more costs.
The younger
if you're
folks have been
younger.
brought up some, yes. I mean, we have, and Jeff, you speak to this some on the rates that we've seen so far, but we have not seen folks who are towards the higher end of the scales, rates really come down. If anything, we've seen younger folks go up. But
I would agree with that. In most cases, it seems like the younger people's premiums are going way up, and in very few circumstances are we actually seeing the rates come down for people that are a little bit
In their 60s.
Yeah, a little bit older.
And that's because we're adding so many people who didn't have insurance before, and we've got to incur those costs anyway. So we're not seeing the benefit, but we're all paying more.
We're all paying.
Yeah.
Correct.
you know, you've got that factor, but then you also have the factor that these new plans have to have certain benefits that I keep going back to. That's really driving costs.
That they don't need.
And then also, Jeff, I don't know if you want to talk about the taxes, but you know, all of our plans now have two major taxes, the insurer fee and the transitional reinsurance fee, that are included as part of our premium starting in 2014.
When you say all of our plans, do you mean the marketplace plans and the non-marketplace plans?
Any plan you purchase in 2014 has these taxes built into it. And they're raising costs. And the insurance companies have started to put it on their renewal forms when they send it out to the, whether it be an employee or an individual, so that they can see what this is going to be. And that's raising costs between 5 to 7%. So right there, before anything else, your rates are going up 5 to 7% to help pay for the taxes. Do you want to talk a little bit about what the taxes are for?
Well, there's a whole lot of different taxes. I don't have a list of them in front of me right now, but to Joe's point, the rates are going up, I'd say 5 to 7% easily on everybody's medical insurance plans. And as he said, we're starting to see the invoicing come out for it, and it's starting to look like your telephone bill. You know, this surcharge for your 911, this surcharge for interstate calls, et cetera, et cetera, et cetera. So there are, I would say, 5 or 6 new taxes that are being levied against anybody who has medical coverage. And, you know, it's just another layer of costs that are being passed on to the consumer at the end of the day.
And we can't avoid that. Whether we buy into the marketplace plans or we go to the or what do you call them, off marketplace,
exchange products.
exchange
Non-public exchange
plans. Okay, but let's talk now, because in addition to the taxes, you can get fined if you don't go through the marketplace.
No, that's it. Just in 2014, individuals are mandated to have coverage or pay a fine.
Okay.
You can secure your coverage. There's 3 different ways you can purchase coverage. You can purchase it through your employer. You can purchase it through the traditional insurance, individual insurance market, which has nothing to do with the exchange. And then you can purchase it through the public exchange. Really, the only people, in my opinion, and Jeff, maybe you can talk about this in a second when I finish this up, that are really going to want to purchase through the public exchange are people who qualify for the subsidies. And Jeff in a minute can talk about why and the difference in networks and so on and so forth. But so basically look at it as 3 different ways. Your employer, if they offer it, traditional individual market, or through the exchange. The exchange is the only place that you can possibly qualify for a subsidy. The exchange is where you're hearing about people having all the problems that they can't get on the HHS website and healthcare.gov, and they can't enroll, and there's concern about privacy and your personal information, and we can talk about that some as well. But we work in all 3 markets through USBC, and we're trying to help educate people on what might be the best options for them. Do you want to talk for a second about the exchange products and how they're different from the traditional products?
Sure, absolutely. The exchange, as Joe mentioned, is the one place that you're able to get your premium tax subsidy if you are an individual that qualifies for a premium tax subsidy.
And who typically,
who qualifies
what
for
do
that?
they look like?
Well, I'm going to let Joe, because Joe's got the numbers on that right now.
So here's the way it works. If you are up to 133% of the poverty level, you can actually qualify for Medicaid. Now, Medicaid is separate from the actual exchange, and Medicaid is actually what's really seen the most people enroll so far. So the Medicaid rolls have grown quite a bit, which is going to cause issues for state budgets, federal budgets, so on and so forth. But if you go over 100, and just to back up, 133% of the poverty level is right about $15,000
Annually.
So
okay.
annually. So if you fall between 133% and 400% of the poverty level, and 400% of the poverty level for an individual is 45,000. For a family of 4, it's 94,000. You can qualify for a subsidy. What happens is the subsidy phases out over from 133%, you would get the maximum subsidy. As you move closer to 400% of the poverty level, the subsidy goes away to 0. So, and there are subsidy calculators. We have subsidy calculators that we can do to help people to.
Okay,
to run.
I want to just repeat a little bit because this is important, and I want to back up for a minute. Okay, so if you're making $15,000 a year to maybe 25, you're going to be at the top of the subsidy range. So this is a good idea.
Well, if your employer offers a medical plan to you and it's deemed affordable by the Affordable Care Act, you do not qualify for a subsidy. So
Okay.
even though you may make $15,000, $20,000, $25,000, whatever the case may be in your example, if your employer offers coverage and it's deemed affordable to you, you don't qualify for a subsidy.
You really need to go through your employer.
And affordable, Jeannie, is defined as the employee must not have to contribute more than 9.5% of their income in order for that plan to be deemed affordable.
Just towards the employee-only cost.
Yeah, towards the employee-only cost.
It doesn't factor in your family cost.
Lord, okay, so if you're making $50,000 a year, 9% of that is about $4,500 just for you.
That means you can be made to pay up to $5,000 a year in premium just for your own coverage. That doesn't factor in if you have a spouse or children or anything like that. So.
And okay, before I get ahead of myself. Okay, so what I'm hearing you all say is these subsidies, first of all, it's going to be hard to get because not a lot of people are going to qualify.
Well, I mean, the folks that are probably most likely going to qualify are going to be the folks that are out of work.
And then would
Or work for a company where the
They're
insurance isn't offered to them.
right, small companies. Okay. But if you're out of work, you can get Medicaid. So why would you go to a subsidy?
One thing that
insurance
I've
plan
seen
you
on
have
that
to pay
is
for?
they're going to look at your annual income. So let's say in your example, somebody had worked 9 months out of the year and then was laid off or let go. They still might not qualify for Medicaid because they're going to look at the annual income. Now, the subsequent year, they might qualify for Medicaid, but
Okay. But really what I'm hearing you say is for the vast majority of us, we're really not going to qualify for much subsidy at all.
if you work for a company that offers coverage and is deemed affordable, yes, the subsidies play no part in your life.
Okay.
And or if you're making close to what that number is, 400% of the federal poverty line, it's like a sliding scale. So you may, if you make 40,000, you may end up qualifying for, $200, $300, $400 subsidy.
On an annual basis almost, probably.
Right, on an annual basis, which is just a drop in the bucket when you're looking at a premium that may be $5,000 a year.
Right. Okay. So we're in big trouble.
Well, I mean, obviously things have not worked the way, President Obama has hoped at this point. And I know we discussed this for a couple of minutes before the show, but he's supposed to make a major announcement today at about 11:30 on what they're going to try and do to fix this. But just being honest, and Jeff and I being in the business as long as we have been, we've both been in the business since the early 1990s, and not trying to take a political stance one way or the other. This law was just not well thought out. I mean, it just seems like...
You know what? This isn't political. Honestly, this is individual hurt.
It is, and it's really hurting a lot of people right now.
Regardless of your politics, who has an extra $5,000 after their income taxes to put away?
Yeah, and Jeannie, when we talk about the $5,000, for example, and an example of what the premium may be, we haven't even discussed what the benefits are.
Right.
Because in many, many cases, the maximum out of pocket, the total exposure that a person is going to be on the hook for or liable for at the end of the day is much higher than most of the policies that we sell today.
Well, here's what doesn't make sense to me some more, in addition to what we've already talked about. So I'm all for people being able to get insurance because I think it's horrible what has happened. And I know y'all work for insurance companies and I'm not hitting you personally. but it's horrible. I had a friend who had breast cancer and was going through a divorce, and so she was no longer covered on her husband's insurance, and she couldn't get insurance because she had breast cancer. That's not right. We need to fix that. I agree. But pre-existing conditions, I like that people can still get insurance. You pay all your whole life, then you use it, and then you get dropped. That's not right. But here's what doesn't make sense to me. So we put all these people in these plans to get them insurance because they can't afford it. Or they have pre-existing conditions, which means they probably have medical bills to go with those pre-existing conditions. Now they have a plan, but they still have to pay out of pocket. So how are they going to come up with $5,000? And how is that going to help us?
Well, to sort of speak about what Jeff was just talking about a minute ago, the reason you're seeing your out-of-pocket maximums go up quite a bit on insurance plans, and the maximum amount, supposedly, that an individual is going to be able to pay out of pocket in 2014 is supposed to be $6,350. But we are seeing a couple of nuances on some plans with prescription drug copays that. It's going to be interesting to see how that plays out. But let's just talk about the $6,350 for a second. Traditionally in the past, you may have had $1,000, $2,000, $3,000 maximum out of pocket. One good thing that's going to be nice for some folks is in 2014, everything does have to count towards your out-of-pocket maximum. So your doctor copays count towards your out-of-pocket, your deductible counts towards your out-of-pocket, your prescription drugs count towards your out-of-pocket. Everything dumps into that one bucket. That will certainly benefit people who are sicker and have medical conditions. It'll help them get to where everything's covered at 100% quicker. If you were to ask me who the losers in that scenario are, certainly if you're young and healthy or older and healthy and you don't use the plan a lot, you're sort of being hit with the fact that now you have a larger out-of-pocket maximum to help pay for the folks who are going to use the plan.
And let's talk about families. Say you're a family with 3 kids. Is each child have their own deductible, or can you buy a maximum out-of-pocket that'll go into a bucket?
The law does not allow for the insurance companies to charge more than 2 deductibles or 2 maximum out-of-pockets per family.
So if it's me, I'm a single mom with 2 boys. Out-of-pocket deductibles
would
for
probably
me and
most
the 2
likely
boys,
be $12,700.
Holy cow.
Now, that's in a worst-case scenario. That's if, everybody had a horrible year.
Well, that's my year this year.
Yeah, as we were talking
one
about.
One with surgery. The other one had a foot surgery. I had an appendix out. I'm in a whole lot of trouble here.
You better hope the death panels don't come into play.
Thanks. But okay, so outside of individual at $5,000, let's talk about our families. Who has $12,000? I mean, you get kids in sports, and you're likely to have at least $5,000, maybe $10,000 out of pocket.
You feasibly could. One thing, just to go back for a second, that I think is really important to note, the biggest changes that we're seeing on the new plan designs, because we're dealing with all the new plan designs right now, is how the prescription drug copays are changing. And I do want to talk about that for a minute, because I think that's really going to hurt folks. And this is something people haven't seen yet, and they're going to be shocked when they see the changes. Because the insurance companies now have to count your prescription drug copays towards your total out-of-pocket maximum, it's caused the insurance companies to raise the overall out-of-pocket maximum for their plan designs. Most people out there, and I don't want to get too technical here, have either what's called a 3-tier or a 4-tier drug plan. A 3-tier drug plan is where you have your generic copay, which people are familiar with, your least expensive copay, then maybe a middle copay that goes towards what's called preferred brand name drugs, and then your 3rd tier is your most expensive brand name drugs. Today, most plans, you just pay a simple copay on that. Next year, the insurance companies on that 3rd tier, the more expensive drugs, have either raised their copays quite a bit. We're seeing $80. $99. And another insurance company has done away with a copay on the 3rd tier altogether and gone to a percentage of the cost up to $600 a month. So
per medication. So whereas you may be going in today and making a $60 or $65 copay on your more expensive drugs, your plans, once you renew or move to a new plan in 2014, those numbers are going to be much, much higher.
And a lot of folks just don't have that extra money to pay on those
So they're
prescription
not going to
copays.
be filling their meds.
And one
So we're going to
additional
see people in the hospitals more.
Yeah, and one additional thing that we've also been told is that under the law, there's only a requirement to provide one medication per therapeutic class. So, in other words, you may be taking a medication today, and it's not the one medication that the insurance company covers. And if you have tried other medications that don't work, you may have to pay out of pocket the entire expense for that medication. So I think things are going to...
So let's talk about kids with ADD. Is that what we're talking about? They're going to cover one.
Well, it can be any
med
number of
in that class?
diseases or any number of illnesses, and in some cases, the insurance companies are only going to be offering one medication for whatever that particular illness is.
Wow.
That won't necessarily be, but it could be the case. But one thing we can guarantee is you're going to see your cost for prescription drugs go up.
So on average, say you're spending $15 or $30 for your med right now. What kind of an increase can we expect on
Well,
those?
if you're currently taking drugs that fall into a generic class, you're really not going to see your copays change much, if at all. The folks that are really going to see their copays change dramatically, or what they might potentially just have to pay straight out of pocket, are going to be the folks who are on the latest, greatest drugs, more expensive generally for major medical conditions. You could feasibly have somebody, as a worst case scenario, but you could feasibly, on the one plan I was talking about, currently be paying $65 a month for a tier 3 drug. Let's say you take 3 medications a month, so you're paying $195 combined. Feasibly, and I'm stressing feasibly, worst case scenario, that same plan next year you could pay $1,800 for those same 3 drugs on a monthly basis. Now, once again, that $1,800 would count towards your total out-of-pocket maximum. So if you hit your $6,350 as an individual, you wouldn't have to make those copays anymore. But still, if you go drive up to the pharmacy and you're somebody who's living paycheck to paycheck, and they say we need $500 to fill this prescription, and there's not a generic available, you're in a tough spot.
Yeah, you are, and you really don't have any choice. If you don't have the money, you don't have the money.
Well, like I said, if there's a generic available, you're going to be taking the generic. But in some cases, there's not, and you want the medication that may give you the best chance to, survive.
And all I see are people ending up more swarming into the hospitals because they're non-compliant with their medications because they can't afford them. That's it, period.
And that's something
Worries
probably you guys
me.
deal with a lot. So.
Yes. Okay, well, we're out of time for this half hour of the show, but stay with me because we have so much more to cover. Again, I'm here with Joe Leigner and Jeff Thomas, managing partners at USBC. And can I give out your information?
Absolutely. We'd love for
no
people to
matter
contact
where
us.
around the country, because you can connect them
Correct.
if they need to be connected to an
Correct.
expert in their area. First of all, you can go to their website at www.usbenefitconsultants.com, or you could call them at 678-867-9816. So stay with me, because after the break, we're going to talk more about Obamacare and the Affordable Care Act and how it will affect you. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thanks for staying with us. I'm Jean Pete, and again, I'm here with Jeff Thomas and Joe Leigner, managing partners with U.S. Benefit Consultants, otherwise known as USBC. And before we get into it, because I get very involved listening to you all, I want to make sure folks know how they can get in touch with you. If you have questions or want to be steered to any other expert, if Joe and Jeff can't help you, please contact them at 678-867-9816. You can also email them at info@us-bc.com, and you can go to their website at www.usbenefitconsultants.com. So Joe, Jeff, we talked a lot about what is Obamacare, what is Affordable Care Act, the exchange marketplaces, the sticker shock of the out-of-pocket expenses and co-pays changing, medication expenses going up. The long and short of it is, the simple answer is, we all need to start budgeting our expenses because our expenses are going up for healthcare to the tune of up to $5,000 to $10,000 a year. Could be. About right?
In some scenarios, yes. Hopefully there's going to be some folks in this whole mix that see their rates go down. But, Jeff and I deal with this on a daily basis and handle benefits for hundreds of companies and individuals. And we're just not seeing what we, thought we might see for some folks. We knew a lot of people were going to lose out in this scenario from what we were hearing. But we certainly thought some folks were going to see some big rate reductions. I haven't seen that personally, with the cases that I'm working on right now. Jeff?
Mm-hmm. No, and I would say to echo that, yeah, we haven't seen what we thought we were going to see.
We're all getting insurance, but we're all going to have to pay for it.
Yes.
It doesn't seem like there's not a huge benefit.
Well, I think
at this point.
I don't think everyone's going to get insurance. I think when you start to look at these prices, the premiums, I think you're going to have a lot of people that just say, hey, listen, I'll take the fine. I'll pay the fine. And that's going to further, exacerbate the problem.
And how much is the fine? Let's talk about the fine versus how much it costs to buy the health care. Because if I'm 20-something and healthy, that's going to be a real issue for me. I'm just starting out in my career. I'm not making a whole heck of a lot of money, and I just don't have it.
Mm-hmm. Well, the fine in 2014 for an individual is $95 or 1% of your income, whichever is greater. Then in 2015, it steps up to 2% of your income, and I don't know what the flat dollar amount is, but it's 2% of your income or whatever that flat dollar penalty is or whatever is greater.
So you're talking minimal cost versus what the outlay cost would be
Absolutely.
For the insurance plan.
Absolutely. And then for a family, it's a little bit higher. I think in 2014, the family penalty is $325 or 1% of your income.
And then in 2016, it starts to get more bite to it.
Yes.
It's 2.5% of your income or $695 as an individual. I'll tell you, and I talked to somebody, I won't mention their name, one of our business owners that's literally probably a mile from where we're taping the show right now. And I asked, he's got lower paid individuals on his payroll and some folks that certainly might qualify for subsidy. So I offered to go down there and talk to them about that to see if we could help them get enrolled. And he says he's been told by them that they don't want the insurance. They're just going to go ahead and pay the fine. It's just too expensive, even with, the potential help. But I would caution folks to where if you do think you qualify for a subsidy, you should at least look into it and see if you can, certainly if you find yourself with no insurance today, to see if you might qualify. And once again, Jeff and I can help you with that. But, Jeff and I both at least hope that some people come out ahead with this, monstrosity of a legislation that's been passed.
Yeah. Okay, so let's talk about early enrolling and how that's affecting folks. I don't think people really understand where we're at right now with this implementation.
Yeah, well, what's going on right now in the marketplace, Jeannie, is what are called early renewal options.
Early renewal.
Yeah, and what that simply is in the small business community, maybe say 2 to 50 employees, 2 to 100 employees, many of these employers may have already renewed their health plans for 2013. So
for 2013?
For 2013. For example, let's say a business renewed their employee benefit package on March 1st of this year. What they're doing now is the insurance companies are giving that business the opportunity to then turn around and renew again for a December 1st, 2013 renewal date. So what that'll do is that'll hold off or delay that particular company from having to move to the new Affordable Care Act rating methodology and all of the new essential benefits that are covered until December 1st, 2014.
From March to December.
Yes, that's correct. So all they're doing is they're just delaying the inevitable. So you got that going on right now out there in the small business community. And then for individuals, many individuals are being given the same opportunity as well, to where they can change their renewal date from, say, again, March 1st or April 1st, all the way back to December 1st. And it's all of the ones we've seen essentially are going to be much better off to take advantage of this early renewal offer and renew their benefits in December rather than wait until January 1st or,
What if you're a small business owner and you didn't know that? Can they still contact you and get that done? It's
probably
December.
At this point it's too late for a small group. And let's define what a small group is under the Affordable Care Act. It's 2 to 50 employees, up to 50 employees. So your groups would be the ones that would be impacted by the new adjusted community rating, and were the ones that were offered to early renew Unfortunately for small businesses, most of the carriers had deadlines on when you had to actually request what your early renewal rates would be, and those have really come and gone. I mean, they can certainly still call us, but most likely that ship has sailed. The individual market, you still have an opportunity to call, and if you do have an individual plan today, you should call your insurance company and ask them, say, what would be my rate if I decided to early renew on December 1st of 2013? And you can also ask them to run a rate on what your rate would be for January 1st of 2014, just to get an idea of what those two rates would be, so you can try and make an educated decision. One thing we haven't talked about that's going to be important to talk about is the networks on the exchange, because if you are somebody who may sign up through the exchange and possibly qualify for a subsidy, you need to know the doctor networks are not what they are in possibly your current group plan or individual plan, if you own an individual plan just through the traditional individual market. Jeff, you want to talk about some of the networks? Because I think it's pretty eye-opening. Well, first we should talk about...
And this is what's stirring up the media right now. You know, you will be able to keep your existing physician. We're realizing, no, not really.
Well, first off, not all insurance companies are actually participating through the exchange. Here in Georgia, you have Blue Cross Blue Shield, Kaiser, Humana, Alliant, and a company called Peach State. I'll give you an example. One of the insurance companies, now this is their HMO product. They do have a different product available on the exchange, but their HMO product only offers 64 primary care physicians to choose from in the state of Georgia. And you have to go to one of those primary care physicians to be able to get a referral to a specialist. They have 300, and I think it was 300 something specialists for you to see, and only one hospital group. So whereas today a traditional product might have 15,000 doctors in the state of Georgia, have most of the major hospitals, the networks you're going to see through the exchange are much smaller in many cases. And some of the carriers that are available on the exchange won't even offer products throughout the whole state. It'll be regional. Jeff, you were talking earlier, you may want to expand on this some, about why the networks are small and why the insurance companies are doing the networks that way on the exchange?
Yes, exactly. Well, the network, the size and scope of the network is one of the only areas that the insurance company can determine pricing or can use that tool in order to determine pricing. So what you're seeing is basically skinny down networks that probably give the insurance companies the greatest discounts. So that way they're able to essentially write these products and, funnel all of the insureds to that group of physicians or hospitals and still be profitable.
Okay. So we're not going to have the doctor network we're used to. We're not going to have the hospital network we're used to.
On the exchange products, that's correct.
On the exchange products, marketplace products, if we choose them. And we're going to have to pay more for our prescription drugs.
On all plans, that's regardless of whether you go through the exchange or not.
And we're going to have more taxes on health care that we're not used to paying right now.
Right. The two, and we didn't talk about a dollar amount, but the two main taxes that are going to impact, like Jeff said, there's like 5 or 6 taxes, but the two main taxes are the insurer fee and the transitional reinsurance fee. And I really haven't heard the media really pick this up yet. I think they're so caught up in some of the other stuff yet. But those two taxes alone in 2014 add $20 billion with a B, $20 billion in fees to all our insurance plans. And that's why the insurance companies are saying, because they have to spread that $20 billion across all their policyholders, it's going to add about 5 to 7% to the cost of an insurance policy.
$20 billion.
Billion, right.
Okay. So, again, I'm very concerned about our people. This is all, the consumers are going to get hurt in every way, shape, and form so far that I've heard from. Do you know, I might be asking you something you don't know yet, but is there a second step coming? Are they going to be managing costs? Are they going to be lowering prices are they going to be working with the cost of laboratory, the cost of treatments? Or is this just, oh well, face life the way it is, folks?
Now, this is my personal opinion, but one of the big faults I think the legislation has, and Jeff, you expound on this or correct me if you think I'm wrong. I don't think the law really addressed how do you control cost, and that's one of the biggest problems that leads to spiraling premium cost. And now adding all these new regulations and things that have to be covered and so on and so forth have just driven cost even faster and further.
Well, and that's what should have been done first, no offense. But now we're just going to throw all this money to the people, and then it won't be as sticker shock next year, the year after, and I just don't see anything helping the spiraling out of control costs of healthcare.
Yeah, well, I would say, I think essentially when you have a large number of people that are uninsured today and they go to the hospital, they go to the emergency room for treatment, and then the hospital and the doctor never gets paid. So you've got a large number of people that are seeking their medical treatment this way, and the hospitals are getting uncompensated care out there. They then turn around and basically charge it through to the people that actually have insurance today, and so that's why those of us that have insurance are seeing our premiums go through the roof year after year. So the old system is really not, it's not sustainable either.
No, it's not. But I think, I could be wrong, but I think there's a larger majority than people are realizing that still are going to have crisis medical situations occur, end up getting help, and now there's a whole heck of a lot more people that can't afford to pay their bills.
Well, you can't force people to buy insurance, and the fines are so low. What we're hearing in our personal practice is a lot of those people are still going to forego getting insurance. So,
and even if they buy the insurance, Joe, $5,000 out of pocket, if you have a hospital stay and nothing's covered in one fell swoop, there's going to be a lot of people defaulting on those payments.
Well, if you're somebody who lives paycheck to paycheck and you're in a situation where if you had a tire go out on your car, you couldn't even afford to change it, and unfortunately a lot of people are in that situation, having to pay $5,000 out of pocket might as well be $1 million. Realistically.
Well, those individuals, though, may also be eligible for some cost-sharing subsidies. We haven't even talked about that here today, but people that are on the lowest rung of the income ladder are going to be eligible for cost-sharing subsidies. And so what that's going to do is it's going to basically provide another taxpayer benefit that's handed out to them in order to help pay for deductibles, out-of-pocket maximums, things of that nature. The people who I see really getting beat up and hurting this thing are your middle-class people that are not subsidy eligible. They may be able to have a policy today. It may not be the greatest policy that, they could potentially get, but at least they have coverage and they're able to provide for their family. Those people, I fear, are going to be priced right out of the market. I'm seeing plans.
Well, that's me.
Yeah, I'm seeing plans.
I'm so concerned about me and all of my friends, people I know. Normal, everyday, middle of the road, run-of-the-mill folks that keep this country going.
Yeah, you keep it going. You're the
that
one
are
who's paying the
future
freight.
possible executives that we're going to push down before they can get to those levels. It's very, very sad and scary to me. And I'm not in politics, so I can let y'all know how I feel. But truly, not even me. I'm middle-aged. But these late 20s and 30s families starting out, I don't know what they're going to do. Anyway, okay, so let's talk about the different plans that are available and what the differences are. Almost, I'd rather take the hit monthly and pay as much as I can and manage my bills if I can lower those out-of-pocket expenses. So I know there's gold, silver, bronze. Can we talk about those?
Yeah, there's gold, silver, and bronze. You also have platinum, but I haven't seen any platinum plans really that's come out through.
Nothing affordable.
Yeah.
Let's put it that way.
And then there's also supposed to be a catastrophic plan available, but has a lot of specifics to it. You have to be under 30 years old and meet all this criteria. So we'll just talk about the bronze, silver, and gold, which we're seeing most have quoted. They have to meet, and this is going to get technical, so I'm going to try and keep it as simple as possible. The government mandated that a bronze plan has to meet a certain actuarial value, that a silver plan has to meet a certain actuarial value. So you can have a combination of deductibles, co-insurance limits, or out-of-pocket maximums on bronze level plans or on silver level plans, or on gold level plans. So we're seeing multiple choices in those different metallic levels where people are going to choose. Most of your bronze and silver, for that matter, what I've seen so far, you're going to have the $6,350 out of pocket maximum. Your deductibles are ranging all over the board. The way the law was written, you weren't supposed to be able to have over a $2,000 deductible on any given plan, but it was not actuarial possible for the insurance companies to build those programs, specifically on the bronze level. I'm seeing deductibles of $5,000. Have you seen any higher than $5,000, Jeff, on the bronze level plans?
I don't recall seeing anything higher than $5,000. No.
So, they're $3,000 above what the law was written for, just to make the whole system try and work.
So the cheapest plan deductible is about $5,000 as a whole.
Yes.
We're generalizing
with
here.
the $6,350 out of pocket. Once again, your $5,000.
What do you mean $6,350 out of pocket? So I'm saying my deductible is I'm just buying for me.
Right.
Until I reach a $5,000 out of pocket for that year, that's my deductible.
Well, your deductible, let me walk you through an example. Let's say that you buy a bronze level plan that hypothetically has a $5,000 deductible. Your out-of-pocket maximum, which I'll explain in a second, is $6,350. $6,350. And then let's say you have doctor copays of $35 for a primary care physician and $75 for a specialist visit. If you go for just a routine doctor visit, you're only going to pay your doctor copay, either the $35 if it's a primary care physician, or $75 in my example towards a specialist. Those copays will count towards your $6,350 out-of-pocket maximum. Also, if you go to get prescriptions filled, those prescriptions will count towards your $6,350 out-of-pocket maximum. Let's talk about the $5,000 deductible. If you went into the hospital and you hadn't met your deductible yet, you would be responsible in this scenario for the full $5,000 before anything was covered. Now, that $5,000 does count towards your $6,350 out-of-pocket maximum, but you would have to reach that $5,000 out of pocket. Also, if you went for complex imaging like MRIs, CAT scans, PET scans, that's where you're typically going to run into your deductible, and then also things like outpatient surgery. So your three scenarios where you normally pay towards a deductible is inpatient care at a hospital, outpatient surgery or procedures, and then also complex imaging.
Okay, so once you hit $6,350, 100% of everything is covered?
That's correct.
In medications, copays,
Everything.
everything. Okay, so worst case scenario for me individually, $6,350.
Correct.
Okay, now I'm a family of four, let's just say. Husband, wife, 2 kids. How does that affect me?
You'd be
maximum.
Your maximum worst case scenario would be $12,700.
And that's on the bronze plan.
No, $12,700 would be the maximum that you could pay out on any plan. But obviously, if you went with a gold plan, chances are that plan's not going to have as high of an out-of-pocket.
The $6,350 out of pocket. Yeah.
You'll probably see a lower out-of-pocket maximum on a gold level plan, like a $3,000 or a $4,000 out-of-pocket maximum. It varies as long as the plan meets this actuarial value formula. They can have varying deductibles and out-of-pocket maximums, but as a general rule on your gold level plans, you're not going to have a $6,350 individual out-of-pocket.
Well, what I'm hearing you say is a single mother of 2 boys, I better find $12,000 to put in the bank just in case. I don't know where I'm going to find that.
To be quite honest, most folks won't have to pay that much out of pocket in any given year. But unfortunately, you never know when your time is, going to come.
Well, let me just tell
and
you.
You're going to have a surgical procedures or medical.
A month ago, I had horrible stomach pain. Ended up in the hospital for an emergency appendectomy. I got my appendix out. You wouldn't think that's a big deal. I'm not dying of it. Doctor bill, my out-of-pocket portion, $1,868. Hospital, another $1,000. Haven't gotten the anesthesiologist, don't know about the labs. So one appendix surgery, you got kids, that could happen.
Mm-hmm. Sure.
And you're talking about $3,000 right there. Then add medicine for the whole year, co-pays for the whole year. If the kid's in sports and gets a concussion and you got to go to Children's Healthcare of Atlanta or wherever, I could see it. I mean, I can see that this is going to be at least $5,000 that I've got to find in my pocketbook next year. And I think that's more typical than atypical, no?
It depends. I mean, we see, as long as we've been doing this, we see every kind of scenario you can imagine. We see folks that might only go to the doctor twice a year, and that's all they're going to spend. We see folks that are on 10 or 12 prescriptions a month. It's all over the board. We've seen folks that have $1.5 million claims, in situations. It's just each individual is different, obviously.
Okay. Well, there's still a little bit of sticker shock, a lot of bit of sticker shock out there. It's all over the media. They're changing, ever changing all the time. So as things change, I would hope that you will come back and we can get more word out for our communities. But I'm always so appreciative to have you here. I was so thankful when you came in July. I think we were one of the first folks to get the true information out, and I was so grateful for that. So thank you for coming back and keeping us informed. And again, if you have any questions about benefits, we didn't even get into individual plans, and I have a whole nother question about Aflac. I think that might be a bigger benefit for all of us now. Who knows? And we can talk more about that when you come back. But please contact Joe Leigner or Jeff Thomas, managing partners at USBC, by calling at 678-867-9816, or you can email them at info@us-bc.com, or you can go to their website at www.usbenefitconsultants.com. Joe, Jeff, thank you so much for joining me again.
Thank you for having us, Jeannie.
Thank you.
Important information at an important time, and I'm just so blessed that you come onto my show.
Changing by the day.
And changing, ever changing, so we'll have you back. Thank you.
Thank you.
I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead, and listen here, same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.